Welcome to Beat Diabetes. I'm Dennis Pollock, and it is a Thursday morning, but not an ordinary Thursday morning for me. It's kind of an unusual Thursday morning because a little bit later on this morning I will be going into surgery. You say, what kind of a surgery is that? Well, you probably can guess from the title. It's a cataract surgery. And I'm eager to get it done with. When they talked with me at the surgery center and did the consult, they asked, when do you want to get it done? I said, how about this afternoon? That's just my personality. When something is going to need to be done in my life that is not exactly pleasant or maybe a little bit scary, I'd rather do it sooner than later. So, cataract surgery. Why, Dennis? Why do you have to do that? Well, they told me a couple of years ago, my eye doctor did, that I was developing cataracts. There was a time when I didn't know what a cataract really was. I assumed a cataract is something that grows on your eyes and they have to take it off, and that's not the case at all. Cataracts are the development of cloudiness and blurriness in the lenses of your eyes. It's not really a growth that has to be taken off. It is your lenses are just not working very well anymore. Kind of like a mirror that's all cloudy and you can't hardly see yourself in it anymore. My eyes aren't terrible, but they aren't what they used to be, and they never were that great to start with. So I've been wearing prescription glasses since I was 16, but I needed them before that. I just didn't want to admit that I needed them as a little boy. I just didn't want to wear glasses. So, but now the cataract issue has developed, and I am going to need cataract surgery. I thought, well, I'll just share my experience and you can learn whatever you can from it. I know every cataract surgeon probably does things maybe a little differently, but there's a lot of things that are the same. I could have gotten along without the cataract surgery for a few years. It's not like I can't drive at all. The problem with me driving is I often don't see road signs until I get right up on them. And I just know that I don't see the way I used to. But the thing of it is, what they do with cataract surgery is they remove your lenses, your natural lenses that are in your eyes. They take them out and they put in artificial lenses. And it's almost like you're wearing glasses on your eyes. Not entirely different from contact lenses, but with contact lenses you can take them off and put them on. With these lenses that are implanted, there's no taking them off. They're there for life. So I'm actually looking forward to it. I've heard so many good reports. You might think, well, if you don't desperately need them, why not just put it off? Well, the thing of it is, when they're going to improve my eyesight that much, and that's the way I understand it, we'll see how it works. Why not get the thing done? So in a little bit, I'll be taking eye drops, special pre-surgery eye drops, and then going into the surgery center and getting my first surgery done. They don't do both eyes at the same time. They'll do one eye, and then 3 weeks later or so, they'll do the second eye. They're doing my left eye first. So I thought I'd just share a little bit about the choices I had with the surgeries that my particular eye surgeon offered me. So let me get that paper. So when they did the consult and discussed the different possibilities of different types of cataract surgery with me, they gave me three choices, option 1, 2, and 3. Option 1 is traditional. That's totally covered if you've got insurance, at least for most cases, and with my Medicare and the little bit of extra that I pay on that would have been totally covered. You're still going to need glasses, but and that didn't bother me. I've been wearing glasses all my life, so that was not a big deal. But the thing that I didn't much like is, with option 1, the surgeon uses a blade and does it by hand. So it's a hand surgery. Options 2 and 3, they use a laser. And I just felt like a laser is probably, for right or wrong, a laser is probably a safer bet than having to depend on the surgeon's hands. So I went for option 2. Option 1 is traditional. You're still going to need glasses. for long distance, even for close-up, for pretty much everything. Again, that didn't bother me so much. But option 2 is where they do it by laser. I like that. Plus, I should not need glasses for distance. I may still wear them. I may get some bifocals that allow me to see through a clear glass for distance and then through a reader type lens, a magnifying lens for close up. Because apparently, as I understand it, I'll probably need some type of reader glasses for reading in close up work. So it says there'll be a high likelihood I'll need intermediate computer glasses after surgery, so that's another issue, but that's easily taken care of. So may need computer glasses, almost certainly will need reading glasses. That's the option I chose. Now, option 3 is, I guess, better still in some ways. And that's where they not only, they call it presbyopic IOL with astigmatism correction. It's more expensive. A lot of it is not covered. You pay out of pocket. Now, option 2, you pay out of pocket as well, but not as much. Option 3, you pay out of pocket quite a bit. And the thing that I didn't like about that, besides the fact that I'm going to pay a lot more money, and it's not a big deal for me to wear reading glasses, the other thing is that you can see, you may have glare and halos around lights at night. So you may be driving at night and seeing headlights and there's glare and halos. In fact, it seems like that's pretty likely. And I didn't want that. So it's like, well, if it's more expensive, and then I've got the other negative of having halos around lights and glares at night, I think I'll pass on that. Why pay extra money and have that hassle when all I have to do is put on some reading glasses when I want to read? So that's what's going on. I'm going to be using some special pre-surgery eye drops here in a little bit and heading off to the surgery center. I'll report back and let you know how it went. One of the ways you learn about cataract surgery, besides just Mr. Google, is you ask people that have had surgery. And in fact, my parents had it way back in probably around the early 90s or late 80s. So cataract surgery has been around a long time. In fact, it is the #1 most common surgery in America. More people have that than any other surgery. And the other good thing about it is it's like a 20-minute procedure. We're not talking about 6, 8, 10 hours. And they don't even put you to sleep, although my particular surgeon will put me to sleep just to give me the initial shot that will basically make my eyes numb, but then he'll wake me up and do the rest. But it's very common. It's not long at all, 15, 20, 25 minutes. And but I'll be there longer than that. I'll be there like 3.5 hours at the surgery center and then come home. And hopefully things will go well. So today is kind of the big day. Been thinking about it for weeks. And here, it is finally here, and I decided I'm going to share it with all the YouTubers that watch my little Beat Diabetes YouTube channel. So I'll report back after it's over, and we'll see how it went. Well, it is the first day after my surgery. Last I reported to you was a Thursday. That was the day of my surgery. It's now Friday. And I've got a few notes I wanted to share with you about the experience. First, I want to talk about just the actual surgery. And all I can say about that is it was so much easier and quicker and nicer and more pain-free than I thought it would be. I mean, I really didn't know too much about what I was going to be facing in terms of how they're going to do it, what it's going to feel like. But I will say this, the idea of someone poking on my eyes, cutting on my eyes, slicing a section from my eye and removing it and putting in another one, that just did not seem very attractive. I liked the results that I was hearing would likely be the case, but boy, I sure didn't much care for having someone come at me and cutting on my eyes. But it was so much better than I thought it would be. And I won't go into all the details, but I'll say this. One of the things that bothered me was that I was going to be awake during most of this procedure. and I'm going to be seeing what's going on. And the idea of seeing a guy with some kind of a blade coming at me and poking it in my eye, that did not, it did not appeal to me very much. But the reality was, even though I was awake for most of the procedure, I couldn't see a thing, because my right eye that wasn't being operated on was covered. My left eye had all kinds of instruments and lights on it to where I couldn't see through that either. I could just see some light. So that took away the idea of seeing a guy doing any kind of work on my eyes. And the other thing, of course, is what you're going to feel. And there was almost no feeling at all. They had numbed my eyes so well that I could barely have a sensation they were doing anything. I guess I felt a little bit of prodding, tiny bit, but basically nothing. And the third part of the surgery was, it was so fast. I mean, I had asked one doctor, how long does this take? He estimated 25 minutes, maybe 20. The reality was this whole thing was over in terms of the actual surgery. They did a couple preparatory things before, but the actual surgery was over probably in 12 minutes. And the doctor very nicely informed me, well, that's it. And I was shocked. I mean, I knew it wasn't going to take forever. It wasn't going to be a 6-hour operation, but it felt like it was 12 minutes. I said, so the surgery is over? He said, yep, the surgery is over. And that was it. So it was just a matter of getting in a waiting room for a little bit and finally being released. And that didn't take long either. So they had told me I should expect about a 3.5 hour in and out time. It turned out to be more of an hour and a half. I guess I was just blessed. And they took me right away and they released me quickly. The surgery went fast. And so I was just so thankful. And it's like, is this it? Is this all this big eye surgery involves? And of course, I didn't know what the results would be like, so a little nervous about that. But so far so good. So the second part, they send me home. Of course, I can't drive myself, but I get home and I've got my eye packed with some eye salve. I suspect antibiotic eye salve, because the one thing you always are concerned about after surgery is infection. And so they had my eye packed with this eye salve, and they had it taped closed. My other eye that hadn't been operated on was open, of course, but the eye that had been operated on was taped closed. They told me, wait a couple of hours. They gave me the exact time to open it. And so I did. And waited that time. In fact, I was kind of relaxing and sort of napping. And I went a little over the time they had told me when I could take off the bandage. And Benedicta, I was in the office, Benedicta came up and said, well, aren't you going to take off the bandage? And it's time to take off the bandage. So I did. And I was hoping that I could just take off the bandage and boom, I would see perfectly and everything would be cool. Well, that wasn't the case. It still had a bunch of that eye salve all over that eye. And it was just totally blurry. So no such luck in terms of being able to see very clearly or figure out how successful the operation had been. And they told me, now don't you wipe off all this eye salve. You let that dissolve naturally. And don't you be wiping your eye, touching your eye, trying to clean your eye. You just leave it alone. So I had, my natural reaction was, I want to wipe all this gunk out of here and be able to see, but I couldn't do it. So I just had to wait. And so the rest of the day was kind of a question of me checking my eye, and I would compare my eyes all the time. I'd put my hand over my right eye. How well am I seeing? Left eye. How well am I seeing? And I was hoping I would be able to see a big difference between the operated eye and the one that was not. And the reality is, for most of yesterday, almost all of the day, I could see better with the non-operated eye. It still had a lot of that salve on it, and it was swollen, I guess a little bit, I don't know. In any case, wasn't a lot of evidence that I had had a major eye surgery improvement. But boy, when I woke up this morning, the day after, suddenly my world had changed. and I could see clearly out of that eye, maybe not perfectly clearly, but boy, it was so good. Not only were things clear, and when I covered up the non-operated eye and looked through the eye that had the surgery, boy, it was nailing it. It was seeing very clearly, much better than the other eye. And so not only that, but things were brighter. Things were just so much brighter. It's like, I didn't realize our world has been created in 4K. Up till then, for the last many years, I was seeing things in SD, kind of dull colors, dull browns, dull reds, dull greens. And now suddenly everything is vibrant and bright because of the eye that had the surgery. So that was wonderful. And then I could see clearly. And then when I drove up to the doctor who wanted to see me the next day, which is today, I was just amazed. I just could hardly believe how nice it was. I could see license plates where I could never see them before. Everything looked brighter. The cars, the trucks, the grass on the side of the road, the buildings, everything looked better. And I was like, whoa, this is awesome. So they tested me at the eye doctor, and lo and behold, the left eye that had the surgery was now 20/20. Now, let me tell you a shocker, folks. That left eye has really been my bad eye. And I had at least one case where the doctor told me years ago, he said, well, you're legally blind in this eye. Now, it could be corrected to the point where I could see pretty well. But he said, you're legally blind. So get this, I went from a legally blind eye to a 20/20 eye. Again, not only could I see better, but everything was brighter. It is amazing. Now, this is just day one, folks. This is just one day afterwards. Imagine, I can only imagine how it's going to be better still. Now, I think I got most of the improvement already, so I'm not expecting to triple my eyesight from here on in, but I expect it'll get slightly better over the next few days. And I am so happy. Now, here's another interesting thing. Normally, when you have surgery and people do some cutting on you, you're sore. And they give you powerful pain medicine, oftentimes narcotic kind of pain medicine, just for you to get by for a few days until the pain goes away. They gave me no pain medicine, and I don't need it. I have not felt any kind of post-surgery pain. I don't know why that is. In fact, I asked one of the nurses or the girls that was answering some questions for me today at the doctor's office, why is it I don't feel any pain? Most of the time you have surgery, you have a lot of pain. She didn't even have an answer. I mean, she just said, I don't know. I'm not sure why that is, but it is. Let's see what else we wanted to say. Okay, so 20/20 vision, and now when I compare the eyes, there's just no question. This operated eye is so much better than the other one, whereas the right eye had always been my better eye, but now it is shabby compared to the eye that had the cataract surgery and had the implant. Now, I'm planning to get the other eye operated on too, so I should have two good eyes. But just this one by itself, if this was all that was done, boy, I'd be a happy camper, because I see so much better. Now, the one thing I don't see so much better is reading up close. I see at a distance beautifully. And my camera is only like 4 feet away as I'm recording this. Maybe 3 feet, 3.5 feet. And I see that very well. But for reading, when I've got something up really close, I don't see well at all. Now, and they told me, I could have had a different lens that would have helped me see near and far, but that had its own problems. So I elected to get good distance from far. And boy, that's what I've got. Better than I've had for the last 60 years. I mean, 60 years ago, I wasn't seeing as well as I am now out of this left eye. So I went to the dollar store to check out some reading glasses, because that's generally about all it takes when you have this kind of a surgery if you're going to read something up close. So I actually bought 3 pair. I wanted to try different styles, not styles. I wanted to try the different magnifications. So here's one of them. And this is not going to win any prize for looks, but I can read well with it. So, and to my delight, they also work good for the computer. So I can wear this, and the 1 even the 1.0, you'd think 1.0, that's such a weak magnification. What good can that do? It does wonders. And it works beautiful for the computer. These ones I just tried on are 1.75. I don't even need the 2s or the 3s. They make them much more powerful. I don't need those. So I was thrilled, and now I've ordered some from Amazon that are better and a little prettier than the one I just showed you. So my estimation so far of all this is, wow. I mean, this is better than I supposed. I thought it would be good. I wouldn't have done it if I didn't think I'd get good results, but this is even better, and we're just, as I said, 1 day in. I don't always listen to what people say, but when they tell me how many drops of this antibiotic fluid I'm to put in my eyes and how often, I'm going to do it exactly the way they say. I don't want to take a chance that I could get an infection. And of course, I'm praying. I prayed all the way through before this and after, still praying. So prayer is a big thing, depending on God, but also doing what you know to do. And what I know to do, and I'm no expert on all this, is listen to the doctors. And when they tell me take these eye drops, 1 at each time for 3 per day for the next 4 weeks, that is exactly what I'm going to do. So there we are. You're all caught up. 1 day later, plan to have the right eye operated on in about 3 weeks. And so far, I am thrilled. This is a dramatic time after cataract surgery, and that is when you find out what do you have, when you get to take off this tape and see how well you see it. Now, how well you see things the last time with the other eye, I was expecting, well, I guess I should see pretty good. I wasn't seeing good at all because they filled my eye with all kinds of salve, antibiotic salve, I believe it was, and I couldn't see much. So I'm not expecting too much this time. One thing I do expect, and that is that my eye is going to look all weird and not going to look very attractive at all. And the thing of it is, with the salve, you can't just wipe it out. I mean, the natural tendency is to get a wet cloth and wipe your eye out and get all that out of there. Can't do it. You're not supposed to be wiping your eyes, scratching your eyes, itching your eyes, touching your eyes for about the next week. So you just have to kind of endure it, but it goes away on its own, and within a day it's pretty well gone. You can wipe it if it gets down to the bottom part, but not the eye itself. You may notice, in fact, I'm sure you did, there's a mark above my right eye. You say, what's that all about? Well, it's amazing. With all the high tech we have, they use a very low tech procedure to make sure the doctor operates on the correct eye. So they put a mark on the eye that is to be operated on, and that's why this mark is here, to remind the doctor, don't fool with the left eye. This is for the right eye this time. The left eye was done 3 weeks ago. It's exactly 3 weeks ago that I had the left eye done. Very pleased with that. Let's see what's going on here. And I'm going to pull it off and give the great reveal of what my eye looks like at this point. Not going to be, here we go. Okay, so all kinds of weird stuff, not seeing correctly yet, and nothing too impressive. If I cover my left eye and just look through my right, everything is weird, not impressive, and if I didn't know better, I'd say, well, boy, that sure was a bust. But you just got to be patient and give it at least a day. Some cases it takes more than a day. So this is a step of faith at this point. And I'll get through the day. It'll improve somewhat throughout the day. But last time, the real improvement was when I went to bed at night, woke up the next morning. So this is what it looks like. Not looking too great at this point, but it's going to improve. It is a Thursday. It's been 2 weeks since I had my right eye done, 5 weeks since I had my left eye done, and I've got a pretty good idea of how my eyesight will be. And I am very, very pleased, although I will say that first day with my right eye was kind of depressing. it didn't do nearly so well. In fact, the next day after surgery with my right eye was not nearly so strong as my left eye was one day after its surgery. And I was always comparing the two experiences. But that first day was terrible. I had double vision. So I was lying in bed looking at a picture on the wall of Benedicta and me, and I was seeing it at this place on one point and way off to the side with the other eye. Everything was different. My two eyes weren't working together at all. And I'm thinking, is this what I'm facing? Will these two eyes ever start agreeing with each other and focusing at the same point? Not a very happy prospect, but I had been warned that don't expect too much after your surgery for a little while. And so for that first day, things weren't looking good at all. Day 2, definitely improved, but still the right eye wasn't as strong on day 2 after the surgery as the left eye had been. The left eye was nearly perfect by the second day, and the right eye was not. But gradually, over the course of several days, it kept improving, and I kept testing my eyes one against the other. Is the right eye ever going to catch up with the left eye? And at this point, if it hasn't caught up entirely, boy, it's mighty close. And the doctor tells me I have 20/20 as my vision. And in fact, when I went to my regular eye doctor, not the surgeon, but the regular eye doctor a week after the second surgery, he said, boy, your surgeon did a bang-up job on your eyes. He really did good. And so he was pleased and I was pleased, and I'm seeing so well. So all in all, I just have to say, it's been a good experience for me. Now, I know not everybody has a good experience. Most people do. And most people are very, very excited and thankful about their new vision, but not everybody. So when you're doing cataract surgery, the odds are with you. And of course, you pray and you trust God. So all in all, I couldn't be more pleased. Very, very happy. They were very professional with the job they did. I'm not telling you to do it. I'm just saying it worked well for me. And what a strange thing it is that I can now drive without glasses. From the very first time I got my driver's license and started to drive at age 16, I had to wear glasses. And from age 16 up until the last few weeks, I had to wear glasses to drive. Not anymore. I see better without glasses than I ever did with my glasses.